Live look now from the state capitol, and that is where lawmakers today heard comments on the future of the Hennepin County Medical Center. As we have been following, the hospital is several millions of dollars in the hole right now.
And our chief political reporter, Tom Hauser, is joining us now, keeping an eye on the ongoing effort to keep open the state's largest public hospital, Tom.
Yeah, Leah, officials at HCMC and on the Hennepin County Board have been sounding the alarm about the bleak financial condition of that hospital. In fact, saying the hospital barely has enough funding to keep going on a week-by-week basis. Now, one proposal to shore up the finances would be a bill that would redirect a Hennepin County sales tax that is currently used for Target Field once the stadium is paid off, and raising the tax from what it is now, 0.15%, to as much as a full 1%. That could produce $330 million annual for the hospital. And supporters say it would be a good investment in a facility used by people from across the state.
Hennepin County Medical Center is a state asset. It benefits all of us, whether we live 10 miles from it or whether we live 200 miles from it, because it makes so many services available to anyone who comes to it.
As a level 1 trauma center for both adult and pediatric patients, Hennepin Healthcare provides the highest level of care for severely injured adults and children. This represents the most complex and expensive care in Minnesota.
Now, no one really disagrees that HCMC is a key statewide asset, but Republicans are not on board with a big increase in the sales tax for Hennepin County, which is the state's largest county. Today's hearing was just informational, but there are key votes coming up as they try to find a solution to these incredible financial woes, again, at the state's largest public hospital. It's becoming a major issue for the last month of the legislative session. Live at the state capitol, Tom Hauser, 5 Eyewitness News.
All right, Tom, and let's talk more about this staying here at the state capitol now. Faith leaders also today joining calls to fund HCMC to protect healthcare access for Minnesotans. The speakers sharing stories about community reliance on the hospital and how important it is to keep it up and running.
I worry that its closure could cause the collapse of the entire network that we all depend on.
Organizers say that many of the trauma patients and specialty care patients at HCMC, they're patients from outside Hennepin County, underscoring the statewide role as a safety net.